Dr. Julie Fisher, a medical oncologist here at the Levine Cancer Institute. Very frequently, our patients will be referred for port placement. We use these ports for ease of administration of chemotherapy, blood product transfusions, and lab draws.
Hi, I'm Dr. Wang. I'm an interventional radiologist with the vascular and interventional specialists of Charlotte Radiology. The port is rather small. It's about the width of a quarter. Here's a sample of it here. And the depth is less than ½ an inch. The port is placed in a small pocket created underneath the skin surface, a couple inches below the collarbone here at the chest. And this tubing, it's very small, is placed under lifetime X-ray guidance safely into one of the neck veins here until it's in the proper position. When you arrive, there'll be some paperwork to fill out. Prior to going to the actual room to do the procedure, a physician will come out to obtain your consent and also answer all of your questions. Then a technologist will come out and bring you to the room. A technologist washes the upper chest and neck with a special soap, and to reduce the risk of infection, a sterile drape is placed over the area. To ensure that our patients are comfortable during the procedure, our nurse will give proper medication and sedation in order to make sure there's no pain. A physician will also give local numbing medication at the skin surface. A small incision is made at the chest a couple inches below the collarbone, and the pocket is created where the port is placed. Under lifetime X-ray, which can be viewed on a TV screen, tubing or a catheter is attached to the port and then placed safely into the neck vein. The small incision is closed with absorbable suture, which will then dissolve on its own during the healing process. The port can be used immediately afterwards. For some of our patients, we'll actually leave the port accessed and they'll head directly to their physician offices in order to get antibiotic or chemotherapy treatment. Following port placement, patients can shower after 24 hours, but we recommend dabbing the area dry instead of rubbing it. The reason being is because while the stitches we place are strong, they can still break if they're not completely healed. We often instruct our patients to avoid strenuous exercise, swimming, and use of hot tubs during the first couple weeks after the port is placed. After complete healing, patients can resume all of these activities. Most people who have had their ports placed say they are quite relieved that they no longer have to get poked multiple times when they're in the hospital in order to find a good vein. The port is hardly noticeable, and once it's healed, requires very little care. Thank you for choosing Charlotte Radiology and Levine Cancer Institute as your healthcare provider.